Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about liver disease, and joining me is Dr. John Fucci. You are with St. John's Sapulpa here in Oklahoma, and you're a gastroenterologist and a hepatologist. I want to tell people too, because I always say it's a shoe, but those that can see on your lapel, you actually have a small liver. So it looks like a shoe to me, but it is a liver.
Hopefully a bigger one here.
Exactly. Welcome to the program. Now, we did a program with you before looking at some other areas, Crohn's disease specifically. This one we're going to look at liver disease. Before we start talking about the different types of liver disease, tell us a little bit about the liver and its normal function.
The liver is a digestive organ, which means it produces substances that help you digest. Its primary function is to produce bile. And the bile is produced by the liver, it's stored in the gallbladder, and after a fatty meal, the gallbladder empties the bile into the intestinal tract, and the bile helps you absorb fat. So that's its primary digestive function.
Okay.
However, it also produces a great deal of substances for the blood. It produces proteins for the blood that help the blood clot. It also helps metabolize chemicals, drugs, and other things that you ingest. So it has multiple roles. It's very important. It's one of the largest organs in the body, and it has both a digestive and a metabolic function in terms of producing the proteins and other chemicals that you need to live.
Okay, let me ask this question, because you did talk about the bile being stored in the gallbladder and being released to help digest fats. People may wonder here, well, what happens to, this is kind of related, doctor, what happens when you have gallbladder disease and your gallbladder is removed? I mean, what does the liver do with the bile then? Because there is no gallbladder.
That's correct. It just takes away the storage capacity of bile. But so the bile will drip into the intestine continuously. And it's not quite as efficient, but you know, in modern society, we have plenty of calories, and a little bit of malabsorption of fat doesn't make much of a difference. So it's just a little more efficient if you have a gallbladder. The only major side effect that people have when you remove the gallbladder is some of them have a little bit of diarrhea, because the bile salts don't get reabsorbed as well when they're not released by the gallbladder. They tend to leak into the colon and cause diarrhea. So that's the only major side effect that people have when they have their gallbladder removed. But their digestive function remains
Pretty much
normal.
intact.
Yes.
Okay, now looking at the liver and the role that you said it plays, can you lose part of your liver and still have liver function? Or, you know, when people are in accidents, or, I mean, tell us a little bit about that, because sometimes we hear about liver, just in general, liver damage. Do you have to can you remove part of it and still have the rest work okay? Or are you going to automatically have to have a liver transplant? What? Yes,
you can. There are certain lobes of the liver, and you can remove a lobe of the liver. And like most organs, there's a great deal of redundant function. We can survive with less than 25% of our liver function, less than 25% of our kidney function. In fact, in most organ systems, we don't start seeing symptoms from organ failure until you get below 20%. So we have a lot of redundancy, a lot of efficiency in our organs. So you can remove a piece of the liver. In fact, they've done transplants from one individual to another of part of the liver. So yes, the liver can function if you remove a piece of it, and that happens during trauma, an auto accident. The surgeon may have bleeding there, and he may have to remove a portion of the liver.
Okay, now
do well.
One of the first conditions I want to talk about, because it's something that I've heard more about, and more people saying that they're affected, and I must say more women being affected with this, although that might not be totally true, but that's who I'm hearing things from. Fatty liver. What is fatty liver?
Well, that's a great question, and you are correct. Women have a higher incidence of fatty liver, and basically fatty liver is what it is. It's described as when you have fat deposition within the liver. What you have to understand is that the liver takes care of a lot of metabolism of both sugars, carbohydrates, and fats. And when you absorb carbohydrates and you don't use them all, the liver stores the carbohydrates and converts them to fat and sends them out to be stored in tissues, in fat cells. In our society, you know, there is a epidemic of obesity.
Right.
And when people get obese, and it probably has to do with the fact that obesity is associated with insulin resistance, you have to produce more insulin and the tissues become more resistant against insulin. And what happens is the liver is no longer able to get the fat out of the liver into the tissues, the adipose tissues, the surrounding fat cells, and it stays in the liver. And unfortunately, fat contains what we call free radicals. And these free radicals are chemicals that can cause inflammation and scarring in the liver. So people with fatty liver can develop inflammation and scarring. In fact, they can develop cirrhosis of the liver, which is the worst form of scarring. Cirrhosis of the liver just means scarring of the liver.
Okay.
So when we look at fatty liver, we look at the mildest form of disease, which is what we call stage 1, in which there's just fat in the liver. We call that fatty liver.
Okay.
And another term we use is non-alcoholic fatty liver disease, which is the formal term for it. When you start getting more fat in the liver and more insulin resistance and more free radical formation, inflammation can occur. And that's what we call stage 2, is when you have fat and inflammation. And that's when your liver function tests may, tests that you measure in your blood may go up, and you may show signs of inflammation in the liver.
Now let me ask this question, Doctor, because you talked about the insulin resistance in relation to the fat and not being able to store it. So are persons with fatty liver, are they pre-diabetic, or is it just where there's something happening with the insulin capability?
Well, you're right. A lot of them have frank diabetes. In fact, if we look at the risk factors for fatty liver, number 1 is obesity, being overweight. Number 2 being female sex. It's more common in females, although it does occur in males. And diabetes is the third cofactor, which causes the disease. So yes, most people with fatty liver either have diabetes or have a little predisposition to diabetes. They may have had a little bit of gestational diabetes during pregnancy and things like that. But yes, if you probably measure the amount of insulin produced by their pancreas, it is probably high, and they probably have some chemical insulin resistance that may have not manifest as overt diabetes yet, but they are probably pre-diabetic, which is an excellent term to use for that.
Okay.
Now, when we get the inflammation in the liver, we call that NASH, which is non-alcoholic steatohepatitis. Okay. And that word means, it basically means that this liver, when you look underneath the microscope, looks a lot like people who drink alcohol. Because alcohol can cause the same damage. It can cause fat to come into the liver. It can cause inflammation. So we have to define this as inflammation that looks like alcohol injury, but it's not associated with alcohol.
Right.
And so we use it. We use the term non-alcoholic. We use the term steato, which in Latin means fat, and hepatitis means inflammation of the liver. All these words are fairly simple when you learn a little bit of Latin.
When you break them down.
Yeah.
Right.
But it basically means non-alcohol injury to the liver that causes fat infiltration and inflammation. And that's stage 2. And then it can progress to stage 3.
Okay, I'm going to have to stop you right now because we're going to take a really quick break.
Great.
And when we come back, I do want to ask you a couple questions on stage 2 before we then go to stage 3.
Okay.
Please stay with us. We'll be right back.